I'm excited to welcome to the stage Ashley Thompson, who is a board-certified genetic counselor and founder of ATGC Insights. This is a consulting firm dedicated to supporting patient advocacy organizations. With expertise in clinical genetics, research, and patient-centered education, she helps advocacy groups advance their missions through strategic project management and collaboration. Previously, Ashley conducted rare disease research at the National Cancer Institute and has co-authored multiple peer-reviewed publications. Through ATGC Insights, she is committed to bridging the gap between the clinic, scientific research, and patient advocacy to ensure the voices of patients and families drive meaningful change in rare disease care. Welcome.
Hello, everybody. What a special day and a special opportunity to be here with you all. Let me make sure the clicker works. All right, there's my bio. All right, so we can go ahead and get started. Oh, can we hear me okay? Is this better? Okay, wonderful. All right. And so I'm really honored and excited to be here today to talk to you guys about something I'm very passionate about, and that is the expanding role of genetic counselors in advocacy. And I would be remiss if I did not mention from the get-go that actually one of Worldwide's very own is a genetic counselor himself, Derek Ansel. And so that is another example of a genetic counselor working very hard in advocacy, and I will highlight the work of myself and others today as well, but I wanted to make sure to acknowledge Derek. All right. So I know we've heard my bio, but just to give you a little bit of background about myself, I did study biochemistry at Converse University in South Carolina, and after graduating, I moved to this area, to the DC area, and I was for several years a fellow at the National Cancer Institute, where I worked on several natural history studies, primarily inherited bone marrow failure syndromes and Li-Fraumeni syndromes. I did a lot of clinical genetic research, studying whole exome, doing variant classification, and also had the opportunity to engage with patient advocacy groups like Team Telomere, Katie Stevens here in the front, and we did a qualitative research study in collaboration with Team Telomere. It was fantastic. And so really had, a good opportunity to be exposed to the important work that patient advocacy groups do in the community. And so that inspired me to then go on and complete my training in genetic counseling, where I continued to serve as a research associate at the National Cancer Institute and continued to do work in collaboration with other patient advocacy groups as well. And so at the conclusion of my training, I was really seeing a need that a genetic counselor with a research background could fill, and that is what inspired the creation of ATGC Insights. And so you've already heard about my organization or my consulting firm, but I did want to just give a little plug here that the ATGC is not just the 4 letters in the DNA code, it also stands for Ashley Thompson Genetic Counselor. So that was pretty nifty, wanted to point that out. So I will talk about some of the work that I've been able to do with ATGC, in addition to, like I said, highlighting the important work of other genetic counselors in advocacy as well. So for today's presentation, like I just said, we'll showcase the expanding role of genetic counselors in advocacy. I'll highlight some real-world examples of genetic counselors making an impact, and encourage collaboration between genetic counselors and patient advocacy groups. So one part of the definition of a genetic counselor, as defined by the National Society of Genetic Counselors, is genetic counselors equip and empower patients and their families with information, guidance, and emotional support throughout the process of learning about one's genetic health risks. And I think it's not incidental here that if we just substitute genetic counselors with patient advocates and patient advocacy organizations, the definition still stands quite well. Patient advocates equip and empower patients and their families with information, guidance, and emotional support throughout the process of learning about one's genetic health risks. And I think this transferability between genetic counseling and patient advocacy is not without undue cause, as advocacy is actually one of the core competencies of genetic counseling training. So this 19 is not a typo. Advocacy is the 19th out of 22 core competencies included in genetic counseling training, where we're encouraged and required to graduate, advocate for individuals, families, communities, and the genetic counseling profession. And several examples of this, as defined by accreditation standards, include recognizing the potential tension between the values of patients, families, communities, and the genetic counseling profession, support patient and community interest in accessing or declining social and health services and clinical research, identify genetic professional organizations and describe opportunities for participation and leadership, and employ strategies to increase and promote access to genetic counseling services. And I think this is really a unique example of how, again, that overlap between the work of genetic counseling or genetic counselors and patient advocacy really complement each other well, as we share a lot of the same goals. And so most of you are probably familiar with genetic counseling from a clinical standpoint. And so while the vast majority of genetic counselors are in clinic, they're found across multiple specialties. It looks like maybe some of the specialty got cut off here, but they're found across many specialties as listed here, but primarily cancer, pediatrics, and prenatal. Those are considered the big three. But they also are further subspecialized in neurogenetics, genomic medicine, cardiology, and other general and adult genetics. And I think that's one thing that's really unique about genetic counselors as well, is that when we complete our training, we do have experience in all of these specialties. So a genetic counselor can go on to serve in the specialty of their choice, and even halfway through their career can decide to change specialties. And so that's something I think is really unique about genetic counseling. And while we primarily exist in the clinical setting, genetic counselors can be found in diverse work settings across laboratories, government, hospitals, universities, biotechnology, and nonprofit. And so it comes as no surprise that with genetic counselors working in such diverse work settings, the roles held by genetic counselors extend beyond clinical practice and into advocacy, like we're talking about today, direct patient care, education and teaching, management and administration, scientific and report writing, program development, and research. And the genetic counseling as a profession is rapidly growing. So in 2024, there were over 6,900 certified genetic counselors, with approximately 2.5 of those reporting holding some role in advocacy. Those holding a role in advocacy at a full-time capacity was far less, about less than 1% of genetic counselors in a full-time position. But by 2034, there are likely to be over 11,000 genetic counselors, which would not only serve the growing need as we learn more about genomics and genetic medicine, but also allow for the continued expansion of certified genetic counselors to serve in roles outside of clinic, like in advocacy. And so why does this matter? So the training of genetic counselors uniquely positions them to serve as a bridge between patients, researchers, and decision makers. And advocacy efforts led by genetic counselors have the potential to improve patient outcomes, expand access to care and resources, increase community engagement, advance research and education, influence policy and legislation, and so much more. Also, I would like to say that AI has come a ways, and this image is AI created. So, I'm not going to take credit for making it, but I was quite impressed. All right, and so how does ATGC Insights or myself engage with patient advocacy organizations? So I'm going to put some bullet points up here on examples on how I've done this, but then I'll give you some real-world examples over the past few years on how I have engaged with patient advocacy organizations. So one of those items would be through patient education development, clinical genetic and clinical research translation to a lay community. I've served as a liaison between patient advocacy groups and genetic testing laboratories, advocating for the inclusion of specific genes on panels, relevant panels. I've helped with registry and database development, the curation of genetic testing reports, community engagement and research efforts, patient journey mapping or some qualitative research, so really learning about the patient experience. And lastly, I've helped to facilitate a lot of external research collaborations between patient advocacy groups and their partners. And so some real-world examples, I have a couple of collaborators right now, but one of those would be the Schwachman-Diamond Syndrome Alliance, who is a Chan Zuckerberg Initiative grantee. I see we have some of those here today. And so one of our initiatives that we have right now at the Alliance is the SDS GPS program, which is also stands for the Global Patient Survey and Collaboration Program. And while this may appear to be a registry, it also we hope that it has a much larger and long-lasting impact than just a registry. So while we are collecting clinical data, head-to-toe survey, genetic testing reports, and other outcome measures, we hope to use the GPS platform as a way to engage long-term with the SDS community and ensure that their contributions to research make a difference over time, and we can engage them with a broader audience. And so my part of the GPS program is curating the participant-provided genetic testing reports. While I do check the variant classifications of the variants that are identified in these genetic testing reports, SDS Alliance we can't provide patient care, but what we can do is make sure, if we notice a discrepancy, I can make sure that patients in our community are connected back with their providers to check on that change in variant classification. So that's a gap we've been able to help fill in our community. Next with the Alliance is a study that I'm leading and I'm very excited about. It's a qualitative research study titled the SDS Patient Lens Study, with LENS standing for the lived experience, needs, and stories of individuals with SDS. So we're interviewing patients, adult patients, and caregivers with SDS to learn more about their experience with SDS. And so the goal of this study is ultimately, in the short term, to inform our PFDD efforts. The SDS PFDD will be held in June. So the aims of the study are to supplement and support what we learn at the PFDD meeting, but also long-term, we hope that this study informs the other initiatives that we have at the Alliance, in addition to really advocating for the patient community, our patient community, and informing you all and the other researchers about the SDS patient experience and where other gaps might exist. And I have had, and this has been a really unique opportunity, to work with a genetic counseling trainee at the Mass General MGH Institute of Health Professions. They have a genetic counseling program, so I've been able to engage with a genetic counseling trainee at this program, and we've been working on this study together. And so it's been a really unique opportunity to engage with a trainee, mentor her through this process, and also from a young start in her professional career, show her the importance of advocacy work and how she really can make an impact. And the last collaboration I'd like to highlight is that with Cure VCP disease. We just launched this initiative this week in honor of Rare Disease Week, this initiative is titled A New Hope, Wellbeing in Rare, and I'm very excited about this initiative. It's a initiative that hopes to target the mental health disparities seen in young adults in the VCP disease community. So this will be a program that we hope to make sustainable long-term for many rare diseases, particularly those that are autosomal dominant, by providing a sense of community and empowerment, access to mental health resources, and also genetic counseling and testing for those who are interested in knowing what their risk for developing disease would be. And so this is a program I'm leading. For legality's sake, I want to say I will not be providing the genetic counseling. I would need to be licensed across the United States. We are partnering with a telehealth genetic counseling organization to help us do this. But regardless, my skills will be able to serve this community in a very unique way, and I'm very excited about it. And so, for as passionate as I am about the work that I do, and I could talk about it all day, I want to make sure that while I have this opportunity, I can elevate that work of other genetic counselors. So I'm going to share with you a couple genetic counseling spotlights of GCs working in advocacy as well, who some of you might have known of, so you might know of some of these organizations, but want to elevate their work as well. So our first genetic counselor spotlight would be Catherine Anderson. She is a genetic counselor, but her official title is the Community Research Manager of Data Initiatives and Advocacy at Parent Project Muscular Dystrophy. And Catherine shares, for rare disease organizations already powered by advocacy and education expertise, genetic counselors can bring the essential foundation necessary to round out a team. At PPMD, the registry team sees the reflection of their genetic counseling training in all aspects of their job. And here is a broad look at the registry team at PPMD. And Catherine shared with me that the registry team is kind of a misnomer for their team. So they are a group of genetic counselors, but they do much more than just manage a registry. And so they are led by Ann Martin, and all of these individuals on this slide are genetic counselors. But they are led by Ann Martin, who's the Vice President of Community Research and Genetic Services, and she oversees all of these activities. So we've got Lauren Bogue on the left there. She is a curator for the Duchenne Registry, and she leads the development and curation of the registry. Then Kayla Banks on the right is the manager of community research and genetic services. She's the genetic counselor who leads Decode Duchenne, which is a free genetic testing program through Parent Project Muscular Dystrophy. And lastly, at the bottom again, we see Catherine, and she leads newborn screening and early care initiatives. And so while all of these genetic counselors have their respective roles, Catherine wanted me to share that these genetic counselors are able to serve, have a much wider reach than just what their title may suggest. So that all of them participate in education of providers, they participate in content development, outreach to patients and providers, in addition to other education initiatives. And I think that it's really unique to see such a large team, actually, of genetic counselors serving in a patient advocacy space. And so PPMD is a really good example of really how transferable the genetic counseling skill set can be to the advocacy space. Next, I want to highlight the work of Mariana Rea. She is a genetic counselor again, but the director of programs at Expecting Health. This may be an organization that you're familiar with. I grew familiar with them during my genetic counseling training, and we'll hear a little bit more about what they do, but Mariana wanted to share a little bit about her journey into public health and advocacy. And she shared that this required a mind shift from individual patient care to broad population health. And she believes that to include all, you need to continuously seek to understand the needs of all. She shared that her shift into advocacy required learning a new language, which helped to further inform that our words matter. And lastly, one of the most impactful things that she shared is that public health doesn't exist without the public. And so Mariana and her team at Expecting Health really is committed to serving the public in this capacity. And so the vision at Expecting Health is to replace fear and confusion individuals and families face, particularly during pregnancy and parenting, with agency to make the best healthcare decisions for their lives. And so they do this through several different ways. Their resources are quite expansive, but maybe some of the four things that Mariana wanted me to ensure to highlight was their activities in providing actionable and relatable science, where they bridge science-based information with health literacy to create accessible and actionable messaging. They do partner with advocacy and advocacy organizations to ensure that policy, funds, and guidance matches the needs of the communities and trusted partners. They are responsible for leading some coalition building and convening. They lead collaborations between scientists, health providers, and the people affected by decisions through trainings and other technical assistance. And lastly, they create trainings, connection, and other technical assistance, I guess it leads into from the last one, to increase capacity and build skills across multi-stakeholder partners. And so Expecting Health really tries to put their hand on a lot of different pots, you could say, with regards to the impact that they make. And so I would say that they generate quite a bit of action. Here's a screenshot of some of their resources and some of their deliverables that they have, but I would encourage you to explore the resources that they have on their website, as a lot of them are created by genetic counselors and are very helpful. But these resources are quite expansive. They include implementation guides, toolkits, micro-learning modules, educational videos, website development. They also have other condition-specific materials, offer family leadership trainings. They help with storytelling and that training. They have federal industry and community partner collaborations. They design surveys and assessments. They have working groups, many peer-reviewed publications. They present at conferences quite frequently. And more. And so I definitely encourage you to check them out as a resource, even for your organization. They have a lot of newborn screening efforts and patient-friendly materials that may help your organization, a lot of nice FAQs there, and so I encourage you to check them out. And Mariana wanted me to make sure that you all have the opportunity to connect with her if you want to learn more about what they do. So here's her email and then all of the social media for Expecting Health. So I'll give you a second just to take a look at that in case you'd like to connect with her. But Expecting Health really is leading the way in terms of making patient-friendly materials for and about pregnancy and newborns. And the last genetic counselor spotlight I'd like to spotlight is Amy Gaviglio. Amy has been a consultant in the rare disease space for quite a while and is quite well known. Some of you might have worked with her, actually. She is the founder and CEO of Kinetics Consulting. And her focus, she works a lot actually with Expecting Health, but her focus is rare disease and newborn screening, and she provides services in strategy, operations, technology and analytics, content creation and dissemination, policy and advocacy. And because Amy has been working in advocacy for so long, she has had the opportunity to work with many organizations, and this list is quite expansive and very impressive. She has had the opportunity to work with laboratories, CROs, coalitions, advisory councils, patient advocacy groups, hospitals, government entities. Her reach has been quite broad, and she is a genetic counselor who's frequently called upon, particularly for her expertise in newborn screening and rare disease advocacy. And so she wanted to share some of her perspectives on a genetic counselor's role in advocacy. So genetic counselors are being relied upon more and more as genetics and genomics finds itself in the realm of public health and advocacy. She also shares that advocacy is a unique way to use your genetic counseling training to impact the larger population and create sustainable programs addressing bioethics, equity, access, population screening, etc. And so I think this leads in really nicely when we think about especially the genetic counseling training and how to create a larger and more sustainable impact on how we can discuss the opportunities for collaboration between genetic counselors and advocacy organizations. And so these are just my suggestions to you, or ideas that I want to share with you on ways that you can collaborate with a genetic counselor. So you can partner to provide patient and provider education opportunities. You can engage in research projects together, develop advocacy strategies and other initiatives tailored to your respective rare disease community. You can invite genetic counselors to serve as medical advisory board members, or even some advocacy organizations have gone so far as to form a genetic counselor advisory group. And lastly, this is something that also is close to my heart. You can interact with genetic counseling trainees through lecture opportunities, internships and rotations, and research projects. It is not uncommon for genetic counseling students to participate in an advocacy rotation. That's something that's very common and many programs would encourage. And so if that's something that you're interested in, I would encourage you to reach out to your local genetic counseling program if there is one. You can also get in contact with me and be happy to share a list of programs that are interested in having advocacy rotations for their genetic counseling students. And most programs, I think if not all programs, genetic counseling programs do require a capstone or a thesis project for graduation. And it's also not uncommon for these genetic counseling students to partner with advocacy organizations to not only perform this capstone research for their graduation requirement, but to also help promote a certain advocacy organization and their internal goals. So I would encourage you to explore trainees. And I think that this also positions, or it uniquely positions genetic counselors to be engaged with advocacy organizations from a very young point, or early point, I shouldn't say young, but an early point in their professional career to really allow for a longitudinal relationship to be built between advocacy and genetic counselors. So there are benefits to collaboration, and I may be biased in presenting these to you. But through the collaboration between genetic counselors and advocacy organizations, we can enhance patient-centered advocacy efforts, strengthen research and policy impact, expand access to genetic counseling resources, and develop long-term relationships, as I just shared, with genetic counselors and trainees for sustained impact. So I think the future of genetic counseling in general is very exciting, but also the future of genetic counseling and advocacy is exciting. And I believe that genetic counselors will continue to shape policy, research, and engagement, increase collaboration with advocacy organizations and industry partners, in addition to advancing genomic screening programs, not just newborn screening programs, but genomic screening programs, legislative efforts, and patient-driven research. And so I want to leave you today with a call to action. And that is to strengthen the connection, or continue to strengthen the connection between genetic counselors and patient advocacy efforts. And you can do this by a couple ways of giving a few options. You can identify new opportunities to engage with genetic counseling students and genetic counselors, as I've said a few slides ago. And I also encourage you to collaborate with genetic counselors to drive meaningful change in your organization. I hope today I've been able to show you a few good examples of how genetic counselors really have partnered with advocacy organizations to do such. And so I really appreciate your time, and I welcome your questions. Feel free to scan the QR code and share your contact information for us to stay in touch. But thank you for your time.
Thank you so much, Ashley. I really appreciate your presentation. Any questions off the gate? Please, Michelle.
I appreciated your suggestion to reach genetic counseling students and for advocacy groups to help them. Is it your experience that, because for me, I just got my doctorate in nursing. I always had to have a nursing mentor at the organization I was working with. Do the organizations have to have a genetic counselor on staff in order to support a genetic counseling capstone experience?
That's a great question. So in order to have a genetic counseling student perform a formal advocacy rotation, that would require a genetic counselor to be on staff. But that does not prevent students from engaging in research opportunities with organizations. So you don't need a genetic counselor for a student to participate in research with an advocacy organization, although it would be encouraged. But they're going to have, for these capstone and thesis projects, they'll have a capstone or thesis committee, and that will also include genetic counselors, so they can help guide it from that perspective, the research process. So for research, no. But if you want a formal advocacy rotation, for their course or for their graduation requirements, it would be required. But a lot of students are still open to taking advocacy rotations, actually, that don't count towards their official hours. So that's something to explore as well.
Thanks, Michelle. Any other? Got a bunch of questions. You can wait.
Hi, Ashley. Thank you so much for your presentation. I think genetic counselors are unsung heroes.
Thank you.
I had one comment, and then I do have a question, so I promise I'll get there. But I just wanted to share for the patient advocacy groups, the Northwest Rare Disease Coalition is working on a toolkit right now that will be released in the next couple of months that really focuses on how patient advocacy groups can partner together to do presentations with genetic counseling programs, with the goal of creating the relationship and really more collaboration, similar to what Ashley presented. So just wanted to plug that. And then my question for you, Ashley, is knowing that there are patient advocacy groups here in the room, what is one thing that you really wish they knew that they were incorporating into their materials, gaps that you frequently see?
That's a good question. A lot of gaps, but not as a result of the organization themselves. It's just gaps in our rare disease communities that they're experiencing. So I could sit here and name a lot of those that I've heard from our community recently. Gaps that I frequently see. I think it would be helpful to provide, let's think. I think it would be, right now, most recently, I've had a lot of folks reach out to me interested in their risks. They're an infected individual themselves, or they have a family history of the condition. So there's a great need to fill patient-friendly materials that are disease-specific about the risks for recurrence of disease, or learning about carrier screening. That's a risk. That's just something that's come across recently. So those are resources I'm helping to develop that are disease-specific. There are a lot of good, wonderful resources that are disease-agnostic, but disease-specific resources, that's a gap I've seen. But also I think another major area or another gap that I've seen is actually the other implications to participating in genetic testing outside of the health implications. So especially for young adult individuals, they're interested because they don't know what they don't know about the financial implications to participating in genetic testing, particularly for autosomal dominant conditions that they might pass down to their family members. And so it's actually encouraged to, let me take a step back. It's unfortunate that genetic testing results can be used to impact the eligibility for life insurance, disability insurance, and long-term care insurance. And so a lot of these individuals, especially young adults, really want to know about the implications of that prior to participating in genetic testing, because then that could be used against them. So there's quite a gap there in a need that these individuals are hoping to, that I'm helping at least Cure BCP disease help bridge that gap. But I think across the rare disease community in general, particularly for those dominant conditions, that's a pretty big gap. There are other implications to participating in genetic counseling and testing. And just because you have genetic counseling doesn't mean you have to have the testing portion of it either. That's another gap in knowledge that I've seen frequently come across, particularly in these dominant conditions. Those are just a few, but I could keep going.
Great question, Cody. Thank you. Karen, did you have a question?
I have a question about newborn screening, that there's a lot of changes coming up with how they're going to do it, and what do you see will be the future of newborn screening?
Good question. I think there's a large push right now to into the genomic newborn screening space. There are various opinions about that in the community. Not sure what my personal opinion on it is yet. I think it's important to, at least take the time to make sure these are thoughtful initiatives. Whole genome sequencing is nothing to play around with, and we need to take that seriously. But I do think that there will be quite a large push into the genomic newborn screening space. We see that with multiple studies. There's multiple initiatives. I'm trying to think. There's a very large one out of California right now, and I can't remember the name. I'll have to loop back to you on the name of it, but I know the state of North Carolina as a whole is actually trying to pilot a program for genomic newborn screening. And while I think this has the opportunity to create large impact, we'll also find that there are more incidental findings that might also have the impact, and we need to be prepared to manage and navigate those.
Okay, let me get around here.
Thanks so much for your presentation. What can we learn from the international community? When you look across the world and see other countries' approaches, what do you wish the United States invested in or did differently that you see in other countries?
That is a great question, and actually one that I would be excited to answer. I've recently talked with a few international patient advocacy organizations, and I think there's the misconception that, maybe not misconception, maybe misconception is the right way to put it, that maybe international patient advocacy organizations can't have as large of an impact because they are international. They're not in the United States, the huge United States. And I think that's not an accurate representation. The international patient advocacy groups that I've had the opportunity to interact with and even do work for have really had a large reach and a big impact on their respective rare disease at a global scale. And I wish that was... I think that's growing. I know that CZI, so the Chan-Zuckerberg Initiative this year, has expanded their grantees to include international patient advocacy organizations. And I think that's wonderful because there are so many advocacy organizations outside of the United States who could use the additional financial support to promote their really important initiatives. So I think maybe bringing a little more humility to the table as at least someone who's based in the U.S., in that there are organizations making equally large, if not larger, impacts outside of the United States as well.
I'm going to ask a follow-up question.
Yeah.
I'm also thinking about your role in particular in terms of the genetic testing that we see happening in other countries. I'm thinking of China. And the way that different governments are investing in this testing.
Yeah.
I would love to hear your comments, if you can, about any of that.
Yeah, and I think that goes to maybe a part of your first question that I maybe didn't answer in full, in that I think it comes as no surprise, especially right now, that I think the United States could be doing a better job at ensuring funding is not stripped from especially these rare disease communities to ensure access to and coverage of genetic testing in particular. And I think that that's something actually that we really could take from the larger international community, is that the coverage for and cost to patients seeking genetic counseling and testing is covered at much higher levels than what we experience here in the United States. And so I think that's another message we could take. I think there was another point that I wanted to hit on with that, in that, I will say though, at the caveat that sometimes sometimes it can be harder to access genetic testing opportunities abroad, and it can be harder to facilitate those. So in my experience, we'll have international patients or families reach out to our US-based organizations asking for help accessing genetic counseling or testing. And that is it's a harder gap to fill, because one, we're less familiar with the resources that are available internationally, but also the laboratory landscape is so different. There are international laboratories and laboratories that, accept samples from abroad or overseas, but there are many technical and logistic considerations to that. So that is a gap that I think needs to be filled in terms of reducing that barrier. So it's all about getting these communities connected to the right folks, but then you got to find them, and so it is logistically a little harder. But when they have access to it, they do get it covered much better than we do here in the U.S. Yeah.
Hi, Ashley. Hi. I love everything that you're saying. I agree with everything. I think is the more you keep speaking and answering the questions, I think you're uncovering more and more just the difficulties around genetic testing, but also providing equitable genetic counseling. Also want to put in a plug for what Mariana and team are doing with Expecting Health, especially as we learn more about newborn screening and newborn sequencing. They were so invaluable for when I was in a genetic counseling program to provide that care for family members who tested positive in newborn screen. Question for you, as many in here are within or affiliated with or have started their own patient advocacy organization, when do you think they should consider to bring on a genetic counselor on staff or in a volunteer perspective? Is it as they're forming their clinical advisory board, as they're fielding questions from their own community around genetics, solving patient education? Is it when they're ready to build their registry, a genetic testing database? Probably all of the above. I'm asking a very leading question, but when, in your experience, do you feel is probably when an organization should be considering to at least speak to a genetic counselor around their services?
Yeah, so you're right. I would say all of the above at all of those above time points. But what I do want to acknowledge is going then back, I guess, to the finances, in that, especially at the inception of an organization and in those early years, or really at any point, right? Financial constraints can be a big consideration in the team, the size of the team that you grow and the people you involve. So I don't think it's ever too early to engage with volunteers and to build your medical advisory boards and to include genetic counselors in those groups. I don't think it's ever too early for that. In terms of when to engage genetic counselor and other initiatives, I think take advantage of those advisory boards and councils that you've been able to create. Having genetic counselors involved in research roundtables, I know Team Telomere has done that. Involving genetic counselors in your research roundtables would be a great free way to engage with the genetic counselors in the genomic community. And feeling it out, really seeing what collaborations you can take advantage of when you're starting a registry, when you're launching a clinical trial, when you're hoping to expand access to genetic testing. I think it's worth a continued conversation because some of these genetic counselors might actually have a research interest in promoting or a research interest that you guys could work on promoting together and collaborating together that would also be of no cost to you. Because again, advocacy is such a large part of the genetic counseling training experience. I think that you would be pleasantly surprised to find genetic counselors who are willing to collaborate in that perspective at any phase of your initiative. I hope that answers your question.
Thanks. We might have time for one or more question. Otherwise, I'm going to hand it back to Amy. Thanks very much, Ashley. Another round of applause.
Yeah.
Thank you.
Thank you, everyone.